welcome back to Anatomy and Physiology. I want to say live with your professor, Dr. Sean Clavel here. And we're moving through movement. We're talking about movement. And we've talked about the types of joints that don't have movement, right, or have very little movement, and now we've moved into these synovial joints, the joints that are dedicated to movement. And so the the concept of structure and function really plays out when it relates to synovial joints, because it's the shape of these joints. Kind of a concept that we should also identify is this idea of concave versus convex. So you have in many different shapes of a joint, you'll have a concave surface. So there's your concave surface, where this is the concave surface, right? And then there's like a head or a convex surface, and that'll be this kind of the rounded side. They fit together, right? So I'm trying to give you like a surface here. This is an example of the joint that I think about, a convex versus concave surface. And so it's the concavity, the convexity that allows for these different movements to occur that we'll see. So let's just take a look at the different types of synovial joints that are provided in the body. There are 6 types of synovial joints. So the synovial joints are subdivided based on their shape of the articulating surface and the bones that form each joint. The 6 types of joints are a pivot joint, a hinge joint, a condyloid joint, a saddle joint, a plane joint, and then finally a ball and socket joint. We'll look at each of these more specifically now. Now, the first is a pivot joint. A pivot joint is a rounded portion of a bone which is enclosed within like a ring, which kind of forms a spinning motion. So the primary motion that occurs is rotation, and that's about a single axis. So if we kind of magnify it in here, you can see that one example is that of the proximal radial ulnar joint. And so the axis here is right in the middle of the radius, and you can see that this radius spins in the socket and allows for palm up, palm down, pronation, and supination motions. This ligament here is referred to as the annular ligament. So you can see there's the ligament here. And again, maybe I'll just type it out here for you if I can find my letters. There it is. And so that is the ligament that holds it in place, the annular ligament. But ultimately, that is the structure that's associated with a pivot joint. Spins about one axis, right? Another example of a pivot joint is the C1. Let's get out of here. So another example of the pivot joint is the C1 on C2, often referred to as the atlantoaxial joint. So the atlas, right? The atlas on the axis, and the upward projecting dens articulates with the inner aspect of the atlas. Let me get my hand right here so we can see. Here's the dens. There's the, and then it articulates with the anterior arch of the atlas, or the C1 vertebrae. You can see that here. And so there's a ligament here. The ligament is the transverse ligament, or they refer to it as just the ligament. But the transverse ligament which then allows for motion to occur around this dens. So this allows actually 50% of the rotation motion that comes from the head and neck occurs here at the C1 on C2 uh, atlanteoaxial, the C1 on C2 vertebrae. And now a hinge joint. A hinge joint is where we really take into the concept of this concave convexity. And so in a hinge joint, you have a slightly rounded end of one bone and it fits into a slightly hollow end of the other. So what we have is a convex end of one bone articulating with the concave end of the adjoining bone. So in the case of the elbow, so the elbow is a classic hinge joint, you can see that this is the trochlear notch. What you would have is the trochlear notch of the ulna, that's concave. That articulates with the trochlea, and there's the trochlea. This is the trochlea. Remember the bow tie of our humerus, with the trochlea of the humerus. So there's the trochlea of the humerus, and so that would be the humeral component. And this allows for, flexion and extension. It pivots about the center of the axis there. So it pivots right through. If we were going to draw a line right through the trochlea there, it would pivot around that center axis, right? What you get is flexion and extension primarily from this joint. So again, monoaxial, it's angular, meaning you're going to get just, and I'm going to kind of abbreviate there in my clinical terms, flexion and extension, right? Flexion and extension, and it's about the monoaxial joint. It's one axis. A saddle joint is an interesting one. A saddle joint is where we have, you kind of imagine like a cowboy sitting on a saddle. So both of the articulating surfaces have kind of a saddle shape, which is concave in one direction and convex in the other. And really allows them to fit like a rider sitting on a saddle. So the motions that you can think about are kind of like as you were sitting on a saddle. You can go side to side. You can even rock front and back. So you get movement about two axes. You can go in the sagittal plane, forward and backwards, or even in the frontal or coronal plane, side to side. The most classic example of the saddle joint is the first carpal metacarpal joint, which is your thumb, but all the way down at the base of the thumb. Again, this is really where most people tend to get arthritis in the thumb. But here is the carpal bone, triquestrium, and the first metacarpal, which makes up the palm of the thumb ray. So I can maybe even zoom in here and give us a better example of a saddle joint. So again, there's the first metacarpal carpal joint here that we're referring to. And maybe even zoom in just one more time here. There. And so what you can see again is this very convex concave shape here, but primarily you might be easier to just identify it as a saddle joint, and this occurs primarily in the, there we go, first metacarpal joint, and there's the curve here, and it fits in with, there's a con curve there, but also it goes the other way where it sits that way, and then there's a convexity that goes around. It's kind of a mess to look at here, but the idea is that this joint allows for forward, backwards, side to side. It is the most common example of the saddle joint. A planar joint is, or a plane joint, gliding joint sometimes referred to, is when the bones are flat and they slit, or maybe even just slightly curved, and approximately the same size. But it allows for them to kind of move against each other. The motion at this joint is usually small, and it's tightly constrained by the surrounding ligaments. So we're thinking again, there's the example of the acromioclavicular, but this also occurs in the kind of like the sacroiliac joint, the vertebrocostal joints, and even the wrist, right? So in the wrist, so these where bones kind of slide against each other, maybe even glide. There's very slight movement that occurs here, but it should be identified. A condyloid joint is a articulation where there's a shallow depression at the end of one bone, which articulates with a rounded structure from an adjacent bone. The knuckles, right, your metacarpophalangeal joints, so where your big knuckles are, this is examples of condyloid joints. And then finally, the most mobile joint is a ball and socket joint. It's where we possess a round ball like end of one bone fitted into a cup like socket of the other, primarily a head, right? We've seen that in the humeral head, the head of the humerus, as you see here on the screen, but also the femur has a head that's articulating into a socket. And so this is triaxial, meaning it moves about three different, it moves sagittal plane, it moves in that flexion and extension, as we'll see in the movement, it moves out to the side in the coronal plane, but also I can spin my arm in my socket, and that's where that transverse motion, rotation, comes from as well. So again, the examples here are the shoulder and the hip socket. This is the most mobile joint in the body, and as a result, again, the least stable in terms of the synovial joints. And so there are the six types of synovial joints, again, determined by the structure, which allows for the different movement to occur. So, again, I encourage you to take a look at these and see how they relate to the different movements associated with the body.